The most common airway dysfunction signs, like mouth breathing and snoring and grinding, are generally ignored because parents haven't been educated that they're not normal. So they think that their child snoring is fine, or they think that mouth breathing is not such a big deal because, again, there's such a lack of education out there on what is normal and what is not normal. So one of the biggest things is mouth breathing and snoring, but also things like that contribute to dysfunction, such as thumb sucking or pacifier use. Parents are not educated on how detrimental those habits can be on their child's overall development. We know that the upper jaw growth peaks at age 4. So if we're like sucking a thumb or using a passy until 3, we've missed out on most of that. We've actually narrowed the jaw with those sucking habits. But I know many pediatric professionals, and even in pediatric residency as a dental provider, we were taught, oh, thumb sucking till 3 is no problem. Well, that's not true. So that's one thing that is also ignored, that the thumb sucking is benign. So if you see any of these signs, the mouth breathing, and I wouldn't even say mouth breathing, just mouth open posture. And if you're unsure, an easy way to look for that is your child's lips chapped all the time? That is a pretty easy thing to see. And you know if your child, is constantly needing something or licking their lips. And the reason that happens is when we have our mouth open, we dry out everything. Don't ignore those things. Don't ignore the grinding. Don't ignore the snoring or even audible breathing, I would call it. And don't ignore the mouth open posture.